What should a man having a prostatectomy look for in their surgeon? To me, I think establishing a good patient relationship is extremely important. As a patient, you need to feel comfortable with your surgeon. You need to understand the disease that you have. The surgeon should have gone through the disease that you have so you understand the extent of the disease, the Gleason score, the aggressiveness of the tumor, and so on and so forth. You have to feel comfortable with your surgeon, and I also think it's important that you ask the surgeon what their experience is with a given surgical technique. Clearly, from the literature, the more surgery that a surgeon has done, the better he is at performing that surgery. So when you look at a surgeon that's done 50 prostatectomies and compare him to a surgeon that's done 800 prostatectomies, one would find that the surgeon that's done more surgery probably will have better outcomes. Now, that's not to say that one needs to have 800 or 1,000 prostatectomies to be a competent surgeon. Actually, in the literature, it takes about 20 procedures based on what's been written to be competent with this operation. But I really believe when you look at the robotic surgeons around the country, the more experience they have, the better the outcomes they are. So the surgeons that have done the most cases will have the best outcomes. So you need to ask the number of cases that they've done, and you need to ask them their specific outcomes. How many of those patients are cured with surgery alone? What is the positive margin rate? In other words, when the surgeon does the procedure, is the disease contained within the prostate, and will they require additional therapy such as radiation therapy or hormonal therapy? You should ask your surgeon what their continence numbers are. Knowing how many pads and what the average length of pad use is extremely important in looking at the quality of life after surgical intervention. And then, for many men, potency is an extremely important issue, and you should ask the surgeon what the potency numbers are. Those numbers, with the continence numbers, with the cure numbers, are all important numbers that you as a patient need to know when choosing a surgeon. But most importantly, you have to have the trust and feel comfortable with your surgeon. You may find a terrific surgeon, but if you don't trust him, you're not going to have a good outcome.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.